is Jennifer Pig. This is the ear, eyes, nose, throat, cardiovascular, and respiratory assessment. I have already washed my hands and provided patient privacy. The curtain is drawn. I'm wearing gloves. Can you confirm your name and date of birth for me, please?
Professor Brian Pig, 793.
Okay, and I'll check your patient armband, and that does in fact match. So I've used 2 patient identifiers to make sure I have the right patient. Today we're going to start with an assessment on your head, eyes, ears, nose, throat, and we're going to move into a respiratory assessment, and then we will finish with a cardiovascular assessment. Alright, so starting out, I'm going to use my light, and I'm going to check obliquely. I'm going to get you to look at my nose. And reactive to light. Pupils are a 4 and they respond to a 2. I'm going to feel below your lacrimal glands. I don't feel any edema or any redness. For your lacrimal ducts, I don't see any tearing, any exudate, any purulent discharge. Eyelashes are curling up and they are a dark brown color. There is a scar along the right eyelash, or along the right eyelash line on the eyelid. There's no edema on the eyelids. The eyebrows are symmetrical. There is no visible scarring. They are thicker medially than they are laterally. Does it hurt when I press right here?
No.
Okay. So then we're going to check your central nerve. Number 2, your optic. We're going to talk about the 2 different tests that we provide. So the first one is called the Snellen. Normally we would have you go 20 feet from where this card would be. You would cover one eye and read the top line. If you can read the top line successfully, then that means you at 20 feet can read what most people can read at 200 feet. You would move down the line. We would go as small as you can until you are no longer accurate with your reading. Perfect vision would be 20/20, meaning you can read at 20 feet what most people statistically can read at 20 feet. Okay? And then we're going to do the Rosenbaum test. We're just going to talk about it. We're not going to do it today. That is where you hold a card out 14 inches, and that tests for near visual acuity. You would then again read the lowest line. If you were not able to read letters or words, then we would do a letters test, and you would just read off the letters themselves. Children, we do an animal test. Okay? I'm going to get you to cover one eye. We're going to do a peripheral vision test. You're going to tell me when you see the fingers in your field, okay? So look at my nose. Okay. Okay, cover your other eye, please. Okay. Okay, so cranial nerve number 2 is going to be intact. Next, we're going to check your CN3 ocular motor, your CN4, which is your trochlear, and CN6, which is your auricle. Excuse me, not your auricle, your abductens. Alright, so I am going to shine this light in the middle of the bridge of your nose. Actually, first, I'm going to hold your chin. You're going to look at my nose. You're going to follow this pen, okay? Don't change your position of your head. We're going to check your cardinal positions of gaze. Okay. I'm going to shine the light in the middle of the bridge of your nose. See any kind of hypertrophy. Lights react symmetrically. When I get you to do a cover and uncover test, you're going to cover one of your eyes. You're going to look right here. I don't see any hypertrophy or any abnormal eye movement. No accommodation of the eyes. Uncovered. No pseudotropia. Anything of that sort. Cover your other eye for me. Okay. Again, I don't see any pseudotropia, hypertropia. Alright. Uncover. So CN3, 4, and 6 are intact. Next, I'm going to move to your ophthalmic exam. Okay? we're gonna check your CN2 nerve. I'm gonna use this light that I'm sharing batteries with because children. We're gonna check your inner ear, not your inner ear, excuse me, your inner eye. Okay, so I'm gonna look over your right eye first, using my right eye. Okay. Red reflex is noted, lens is clear. I don't see any exudate drainage. Retinal background is creamy yellow. I don't see any glaucomic coning. Optic disc is about 1.5 millimeters. With no cupping, like I said, for the glaucoma. And so we would assess the left eye as well. For the purpose of this demonstration, we're not going to. I didn't see any scarring or abrasions in the cornea. I didn't see any redness or hemorrhaging. And it's expected in color. Okay. So next we're gonna go on to your ear exam. So that would be your central nervous tube was intact. Now we're gonna move on to your ears, okay? So the ears are gonna be your central nervous 8. So we're gonna start with an external exam. And so I'm just gonna palpate. Your ears are symmetrical, they're apparent in color, as they should be. Is it sensitive when I touch?
No.
Okay, I do see some vascularization along the outer upper shell. I don't notice any scarring. There is a small nevi in the form of a freckle on this one. There is some fine hairs visible, as well as some light brown cerumen. It's very scant, there's not much at all. Okay, so now I'm gonna look in your ear. I'm gonna use the otoscope. We're gonna pull up and back. Again, I see those hairs. Not much cerumen. We're gonna look at the auricle, mastoid. The malleus is in the vertical position. The tympanic membrane is a pearly gray sheen. I don't see any exudate, any redness, any edema. Is it painful?
No.
Okay. All right, so we're gonna do the whisper test. All right. So I'm gonna whisper. You're gonna tell me yes if you hear me.
Yes.
Okay. We would repeat that on the other side as well. So next, we are going to do your Weber test. We're gonna use the tuning fork, and we'll set it on the middle of your head. You're gonna let me know when you hear it, that you hear it equally in both ears, or if you don't. Okay.
Mm-hmm. Yes.
You hear it equally.
Yes.
Okay. So next, we're gonna check the Rhine test, and that's gonna be bone conduction versus air conduction test. Okay, and I'm gonna time it. You just let me know when you hear it and when it stops. Okay. So that is assessing cranial nerve 8, and that is intact. So your AV or air was 2-to-1 to your bone conduction, and that is as expected. Okay. So next we're gonna look at your nose. We're gonna look at your mouth. Okay. I'm gonna use this pin light. We're gonna look in your mucosa. Okay. Theirs are equal. I don't see any lesions or abnormalities. Alright, I don't see a deviated septum or any perforation. I'm going to get you to close one nostril. We're going to check central nerve 1 olfactory. I want you to just gently close your eyes and smell. Tell me what you smell.
Cinnamon.
Okay. Swap nostrils. Okay. So nerve 1 is intact. I'm going to look again. So the inferior turbinates are visible. Okay. And that's not sensitive anywhere on your nose?
No.
No? Okay. All right. Then we're gonna go and do the oral assessment. So I'm gonna get you to look up to me so I'm not squatting down. Open your mouth without sticking out your tongue. Okay. Okay, I'm just gonna count your teeth. Teeth are well approximated. There is some disalignment on the bottom teeth. Look up. No malodorous breath. Gums are pink and well approximated. No marginalization. Stick your tongue out for me. Tongue is well papillated and it's pink. There are 28 teeth present. I'm gonna get you to look up to me so I'm not squatting down as much. I'm gonna get you to stick your tongue out and say ah. Okay, uvula is visible and it stays medial. Tonsils are +1 grade. Visible, they're not red. No inflammation or exudate, no stone visible. Does it hurt at all?
No.
Okay, I'm gonna get you to lift your tongue for me. Frenulum is intact. We're gonna check this one. Okay, open your mouth. Wharton's duct is next to the second molar and that is intact. On the buccal mucosa is pink without any edema. Then we're gonna check your other duct and that is sublingual. Lift your tongue. Okay, so that is your CA9 and 10 glossopharyngeal and your vagus. Those are intact. And you can say ah without a gap reflex. You can move your tongue around. You follow commands very well. We're gonna check your hard and soft palate. Open your mouth. Say ah. Okay, so soft palate moves, hard palate remains. They do stay intact together. So 9 and 10 are gonna be intact. We inspected CN12 as well, and that is your tongue movement. And that was as expected. You were able to move your tongue on command. We are going to move on to your respiratory assessment. Okay. So, I'm going to start just by listening. The chest expands symmetrically. There's good alignment. I don't see any abnormality or retractions. We have good coloration, good breathing pattern. It's slow and consistent. Respiratory rate is between 14 and 16. I'm gonna get you to sit up on. Breathe in. Okay, breathing is clear. I don't hear any crackles or crepitus. I'm gonna get you to look up at me. Trachea is midline. Can you swallow for me? Trachea remains midline. All right. I am going to check your fingers for clubbing. I don't see any clubbing. You have a good capillary refill. Whenever I was feeling on your lungs, did that hurt? When you breathe deeply, does it hurt? Do you cough a lot? Do you have any asthma issues? Okay, do you take any medicine for breathing or use oxygen at home? No? Okay. Alright, so I'm gonna get you to come back here. You lean forward. We're gonna percuss the lung fields. And that is as expected. I'm going to get you to cross your arms and hold your breath. Okay, blow out for me. You can relax. I don't see any comfort breathing or any discomfort, just chest expansion, symmetric. I don't see any shortness of breath. I don't see any JVD or distension, no noted venous patterns. Your veins in your head or neck are not pulsating. I'm gonna check your back. I'm just gonna feel your spine. Okay, so feeling on your spine, I don't see any scoliosis, any lordosis or kyphosis. Have you ever been diagnosed with any curvature of the spine?
No.
Okay. Alright, so then we check on the 10th rib for sporadic expansion. Okay. So we're going to do an assessment on your back. I'm going to tap and I'm going to get you to say 99.
99.
Yep, you're going to say the number 99.
99.
Okay. Okay. And I don't feel any vibrations or anything out of the ordinary. No shortness of breath during that as well. Was there anything that was painful during that?
No.
Okay. So, no triclotting visible, no retraction, no nasal flaring, no subcostal or intercostal retractions, no subclavicular retractions. As I said before, respiration rate is between 14 and 16, so that would then complete the respiratory assessment. That is within normal range. Next, we're going to do your respiratory assessment. So I'm going to start with checking, not respiratory, cardio assessment. I'm going to check your apical, your pulmonary, tricuspid, mitral, and NURS point. Okay. All right. So we're gonna go on the second intercostal space for the apical. And we're listening for S1 and S2 sounds. And I hear those clearly. Then we're gonna go to the pulmonic. And then second intercostal on the left. And I hear that clearly. NURS point is third intercostal on the left. S1, S2. Okay. Moving down, we're gonna go to tricuspid. This is gonna be S1. Okay, and S1 can be heard clearly. Then mitral is fifth left. And there's no S3 or S4 sounds, no squinting. Regular and normal intensity. And I don't see any velocities. Like I said, I don't see any JVD, no edema. We have a less than 3 second cap refill like we stated before. And that's not tender anywhere that I touched you. Okay, no throbbing. Okay. We're gonna check your pulse. We'll start with radial. And that is +2. And then we'll go to brachial. Okay. I'm gonna feel carotid and we don't feel those at the same time. Because we can make you lose consciousness. Okay. I'm gonna feel your feet. If you'll just make sure it's visible. We're gonna do a Holman's test as well whenever we're finished with your foot. Okay, so we'll do pedal, sorry. We'll do the post-tibial. We're gonna skip your femoral pulse today. So the Holman's test, I'm gonna get you to flex up and then flex down. That's intact. Let's see this one. soon. Okay, I'm gonna feel these pulses, and while I'm checking these pulses, we're just gonna go over orthostatic hypotension, and so that would be if you were laying down and we checked your blood pressure, and then you sat up. If your blood pressure dropped by 20 systolic or 10 diastolic points, we would consider that positive for orthostatic. If your heart rate were to increase by 20 as well, that would be considered orthostatic hypotension, and that would be a cardiac follow-up to assess for the cause. Okay, and as I'm pressing on these pulses, I don't notice any gap. It is well palpable. It collapses with pressure, but it's significant pressure. So it's no thrills, no distension. Right, we are going to get the timer out, and we are going to check your heart rate. We're going to stop at 30 seconds. I had 36 pulse or heartbeats, so that is going to be 72 for your pulse. Okay, so now we're going to do a blood pressure assessment. We're going to use a manual cuff. We're going to inflate it, and the first beat that we hear is going to be your systolic value. The last beat that we hear is going to be your diastolic value. See any distension, no heaves, no thrills, nothing out of the ordinary when we did that cardiac assessment, okay? Alright, we're going to inflate this to 160, excuse me, to 180. I was looking at 180 and it said 160. It's going to be 128 over 76. So that's well within the expected range. And then we also have the point of, or the POM, so it's the point of max impulse. That's going to be the fifth intercostal space right here. It's going to be on the mid-clavicular line. I'm going to get you to lean forward for me. Diameter is about 1 centimeter. And about 1 full cardiac cycle. And good S1, S2 can be heard. I don't hear any regurg or murmurs or any adventurous sounds or thrills. It sounds good to me. Do you have any questions for me?
Mine.
Alright, and that completes my assessment.